Hello, everyone, and welcome to our MicroLearn session training about water. On behalf of Project Firstline Rhode Island, we thank you for the impactful work that you are all doing in your various communities. My name is Chilamso Ademegu, and I am a registered nurse. In my current nursing role, I serve as an infection prevention educator for Project Firstline Rhode Island. It is a pleasure to present this training to you today. Now, as a disclaimer, no nursing education credits are offered for this MicroLearn or any other MicroLearn in these series. We are offering a certificate of training for today's session as well as continuing education for dental IPC requirements and EMS. But in order to receive this, you need to fill out the pre-session survey if you have not done so already. Abby will post that in the chat for you all. You would also need to complete the post-session survey that will be emailed to you tomorrow. Okay, now today's session is presented in a dual MicroLearn Train the Trainer format. Before presenting a MicroLearn, check with the policies and protocols at your facility and adapt the content accordingly. Incorporate MicroLearns into existing opportunities where groups of healthcare workers gather, such as pre-shift huddles or team meetings. The sessions should be led or facilitated by an experienced team member with infection control expertise. The MicroLearns reinforce infection control concepts when risks are observed in patients or in the patient environment, not necessarily in visitor or other staff member. Now, this is the agenda for the remainder of our time together. We have already completed our welcome and introductions. This will be followed by learning objectives, introduce the topic, in this case it's water. We'll expand on the topic, how water relates to healthcare, and then we'll discuss how to discuss it with your team, infection prevention and control action. Then we'll do wrap up and reinforce, facilitate specific protocols and answer any questions that you may have. Lastly, we'll conclude with our announcements and end of session feedback. These are our learning objectives for this session. Now, using the MicroLearns. The Project Firstline Infection Control MicroLearns are a series of guided infection control discussions that provide brief on-the-job educational opportunities. Each MicroLearn focuses on a single infection control topic and connects infection control concepts for immediate practical value. Healthcare workers can easily apply the key points to their daily work and perform the recommended actions to keep germs from spreading. Now, each MicroLearn contains a discussion guide and job aid the facilitator can use to guide the discussion and use it as a resource. Now, the first step of teaching a MicroLearn is to introduce the topic. In this case, it's water. This is where you will discuss with your team members the topic of water and how it applies to your team of healthcare workers. Now, when teaching a MicroLearn, it may be helpful to have your staff stop and think about water prior to starting and what potential risks they have encountered in the facility. You can have them take a moment to think about your facility's water system prior to getting started. Now, some questions to include or to consider include, have there been any infections caused by water-associated germs on your unit or in your facility? Another question to include would be, how can you help your team to relate this information to their work? Now, after setting the scene with your healthcare team, you can introduce the topic, water in healthcare. How do we use water in healthcare? And why do we care to talk about it now? Well, we care to talk about it because germs can live and grow in water, including tap water, and these germs can spread and cause infections in patients. These germs include drug-resistant germs such as Pseudomonas, Acinetobacter, and Burkholderia cephacea. This is why all of us need to know about germs in water and what actions to take to prevent infections. Facilitator note, discuss an example of water-associated germs in your facility and how they are handled, or how they were handled. Now, although tap water in healthcare settings can be used safely for activities like brushing teeth and bathing, it should not be used with sterile equipment or when caring for patients at higher risk for infection, such as those with weakened immune systems. Now, once you introduce the topic of water, you will then expand upon the topic and discuss how water poses a risk in healthcare facilities. Next, you want to continue to reinforce the importance of the topic in the workplace and expand further on water in healthcare, such as tiny droplets that you can't even see can splash onto wound dressing supplies, sterile equipment, and other care items nearby. This can be from splashes from a sink or from tasks such as handling ventilator circuits. Non-sterile water, including tap water, and open bottles or of sterile water will have germs in it. So will also like wet environments such as ventilator tubings and areas around the sink. Using tap water with sterile equipment or during certain procedures can also cause germs to spread to patients and cause deadly infections. This is why we never use tap water for surgical procedures. Facilitator note, give some examples that are relevant to your team when tap water is not okay. For example, during surgery or performing trach or ventilator care. Next, as a facilitator of a microlearn, you can discuss with your team infection prevention and control actions that can help reduce the risk water poses in healthcare. At this point in the microlearn, you will discuss what your colleagues and staff can do to prevent risk of water at your facility. These actions include being aware of splashes and sprays and wiping them up appropriately, keeping patient care items away from sinks and splashes. If you find an area that needs a shelf or other storage to keep these items away from the sink and splashes, tell your leadership. Clean and disinfect surfaces and medical equipment near sinks. Never use tap water with sterile equipment or during procedures requiring sterile water. Now it's time to wrap up all of the most important points you spoke about and review with your team your facilities, policies, and protocols of water handling and other opportunities for education. At the end of the microlearn, you will summarize the information for your staff and discuss any facility-specific information, such as water can spread harmful germs in healthcare settings, but it doesn't have to. You can stop the spread by being aware of the risks of water in healthcare settings and by taking action to prevent infections. Here, you can take the time to share facility protocols that may be useful for your team and other opportunities for education. You can also share contact information for people or groups your team can contact to report issues. Here you can see a visual created by CDC Project Firstline summarizing the key points of today's microlearn. This is a great learning aid that can be hung or handed out for quick staff education or as a supplement to a microlearn training at your facility. Now for our key takeaways, it's important to remember that germs can live and grow in water. These germs can spread and cause infections in patients. Reduce the risk of germs to spread from water. Be quote unquote water aware by recognizing when healthcare tasks may involve exposure to water or wet surfaces. Never use tap water with sterile equipment. This spreads dangerous germs to patients and equipment. Be aware of splashes every time you turn the water on. There is a risk for germs to splash and spread to nearby equipment and surfaces. Keep care items protected, making sure to store patient care items such as wound dressings and medications away from sinks and splashes. Now, here are the references used in today's session. Okay, now we've come to the conclusion of our microlearn, but please take some time to complete our end of session feedback poll. This will help us to improve future training to suit your learning needs. If you would like a certificate of training for this microlearn and have completed the pre-session survey, please be sure to check your email tomorrow for the post-session survey. Once we receive that, an email will be sent to you with the certificate of training. Now, with that, we conclude our microlearn session. If you need help with your microlearn presentation or have any questions regarding this presentation, please send us an email. Also, if you have not already, please visit our Project Firstline online page and sign up for our upcoming webinars. Thank you again for your time.